Assalamu alaikum. Welcome everybody to the third and final of the taste for specialty training. I would like to present our first presenter, Sarah. She will start presenting. The first specialty we have is hematology. Sarah, would you like to start?
Yes. Assalamu alaikum, everyone. Today I will present about how to apply for the hematology specialty training. Okay. First, I am Sarah Nasser. I am General Medical Registrar in Plymouth University Hospital. As in the last days, they have gone through all the application. It will be the same format, but the aim of this presentation just to have a successful application. Okay, so we'll try to give some tips to help to have successful application in hematology specialty. Okay, so before you start your application, you have to be sure that you have full MRCB. Your core competence form was fully signed by the consultants and all the evidence you have, okay, for this core competence form to be filled, okay, and about your experience, and they need from you to have at least 24 months medical specialty experience, and at least 12 months to be, you have to be dealing with acute medical cases, and you have UK eligibility, and most of us, we have it. Regarding an English language skills, already this we have when we have done our GMC, and be sure about our GMC status, that you have to be fully registered and you have any problems, okay? You have finished your ALS courses and the dates by the time of application, because they will ask you about it. And the references, be sure that you have 3 references, okay, and you are sure that these references, they will have good feedback about you. And the importance in to plan your application and to prepare yourself to the interview, you have to stick to the timeline for the application as the interview date, okay? So the application process, when we have to go through it, of course, the first step, you have oral application system, and anyone he attended to, he want to start application, he have to have oral account, and through this oral account, you have to look for the vacancies, and you have to specify what you are searching for, okay? Then the application form itself, and how you score yourself through this application, and what will happen after submission of your application, okay? So this is the oral, okay, page, okay? When you are starting, you have to specify, most of you know this in detail, but just I want to draw your attention to some points. When you start to look for the vacancies, just you start with hematology to broaden your search. Don't try to specify any area or any lead, okay? Let the vacancy to be dropped in this place, okay? And when you find it is open, it means that you are in the right track. Try to open it and try to take these details and read it carefully. It gives you the specialty, the date of your post, and how long will be your training, and the opening and closing date. And be sure about these emails, because through your application, after your application, if you have decided to withdraw, or you have any problem with your application after submission, you have to contact these emails, okay? And you have to read about this part, about the information to give you the number of posts you are applying for, and about what could be your training post, what you have to do through it, and the salaries, okay, and about the lead itself, okay, and you have to go in detail in the links also it gives you some links, because they have some I think some links which was specified to the lead. For example, this for North Island, they have a specific criteria they need from you, and they have a special things for the application. For example, as usual, when you submit your application, they didn't ask you about the evidence at the same time, but here they need all the things to be at the same time, okay? And the timeline, it will give you where the application dates and closing, and the interview days, how many, because it will be specific, and the time for the references to be submitted. Okay, so be sure to go through this part in details. Okay, the application form. Okay, the application form for all specialties are the same. Okay, so the most important thing, or the cornerstone for your application for hematology specialty, is to show your commitment to the specialty. Okay, so that is the important thing. First, you have to know that you, as a hematology trainee, you have to be clinically sound. You have to be eager to apply science to the patient. You have to interested in the chronic disorders that you want to see is how you are eager to do this part. Okay, and also you will not be stuck in the clinical part. Just you have also laboratory part. If we say that if the hematology trained about 5 years, in the first 18 months, you will be more concentrated in the laboratory part, on the peripheral blood films, on the bone marrow. So you have to expect that the laboratory part is also fundamental. Okay, so I will try to go through how to show your commitment. The important one, that if you are in the hematology department, you have a role there as HO or Yisrael, it will be great. And it will be best to show that you have a commitment. If you cannot, okay, you can ask your department for tester week, okay, and you can take it like a study leave, okay, and try to attend all the activities, the MDTs, the morphology, MDTs, and they have all the activity you have to attend are reflected, okay, in your portfolio. It will help you a lot. And also if you get a rotation there, clinical QIBs or audits, that is the most important part. If you are lucky, or I mean that if you concentrate to have clinical audits in hematology, and you started to do all the cycle by yourself, you will gain about 10 marks, which is brilliant if you get this one, and because it will take your score to be up, okay? And if you have additional, for example, if you are involved in teaching in hematology, I mean teaching, we are specified under undergraduate student. So for example, in my hospital, there is a postgraduate center, and there is curriculum there for the hematology. If you went there and tried to see how the medical student, what is the curriculum for the hematology, and try to do part of it and get a feedback, it will mean a lot, okay? And if you have a time to attend the outpatient clinic, the morphology and MDT meeting, if you cannot do all this tester week or rotation, you can try in your off time to try to do this one and reflecting in a portfolio, it will be the better. Okay, here that is course called Morphology Update for biomedical scientists and first year senior trainees, okay? It is a course to enhance the skill in the peripheral blood morphology. This course held 2 times per year, okay? You can apply for it, and even if you didn't attend the course, but you have evidence that you have applied for this course, okay, also it will give you some point, okay? If you got any presentation in hot hematology topics, any case-based discussion, any case reports, it will be helpful, okay? So not don't concentrate to fulfill all these tips, but try to concentrate mainly on the audits. It will be the best, and the how to be involved in the hematology activities. Okay, even if you have discussion with the hematologist and try to build your knowledge and show your commitment with the specialty, also this can be added, okay, and consider as a commitment. Okay, then we have to go to the scoring. We know that the scoring that you are scoring yourself, okay, and then just you're not scoring yourself, but also you have to have show evidence for it. Okay, so the scores, it depends on achievement and qualification you have, okay, and you have to choose the most appropriate option for each achievement. Okay.
Can you try to sum up in a minute or two?
Yes. Sorry.
Can you try to sum up? I mean.
Yes. I mean that now I have tried to say that how the important thing, how to show the commitment. Okay, and I explained that commitment is the most important part in to get successful application. And at the same thing, the scoring system. The scoring system, it depends on your self-assessment and the evidence you have. So when you are assess yourself, and my colleagues in details in the few days, they have talked about the teaching, about QIBs and everything. So you have to put the best option. I mean, that's your achievement according to the best achievement according to the to what they need from you. Okay. Okay. So after you have assessed yourself, okay, and after closing of the application, they will ask you to upload your evidence. Okay. And your evidence will support, you have to claim for each one. Okay. So there will be the senior clinician who will look about the application and the evidence about your self-assessment and the evidence, and you can they give you more than score yourself, or it could be lower than this. Okay, so try most of the time to score yourself appropriately. Okay, don't overestimate or underestimate yourself, but I mean that avoid overestimate, it will be more critical. Okay. Okay, so if they have more applications, okay, they will take the most, I mean that most successful or most appropriate evidence. They will ask them for interviews, okay, and they start to give them start the ranking and offers according to this. Okay. Okay, so I have few points about the evidence. I know that everyone know about the evidence, and there is specific things that need to be remembered, that you don't need evidence. Sometimes you have, for example, I know that for any point, for example, for the teaching, you have no experience. I mean that for teaching or I mean for presentation, for example, you have no international one, or you have no regional presentation or anything regarding this. This is the one part. Okay, so if for any part, if you have more than 3 parts, you have no evidence, so no one will look about your application. Okay, and you have to claim you have to claim for the evidence for each one you have uploaded. Okay. So I have to draw your attention, if you have evidence of training courses for area which show your commitment, you cannot claim for it, okay, unless it is specified to the scored option. Okay, so if example for the teaching, okay, you have teaching showed the commitment, but at the same time you cannot depend on the teaching alone that it will increase your score. Okay. Be sure that when you have any patient identifiable data, you have to avoid to show anything relating to the patient, because it will let you to be redacted from your employee trust, and they can be notified about this.
Sarah?
Sure. Yes?
You need to sum up just because of the timing.
Yes, okay. Okay, so then I have then after the submission your application, okay, you have, according to, you are legible, so you will be a long list, okay. All the application have the requirement, okay. If you the shortlisting, it will occur when there is the capacity. I mean that the applicant are more, so they will have take the more appropriate one, or more they have good evidence, and they have introduced them to the interviews. Okay. Okay, so when you have received your invitation for to the interview, and this will be at least 6 weeks before the interview, you have to book your slots, okay? And then I will go to the interview structure, and because you have to know what you have to be interviewed for. So you have at least 4 stations, okay? Or 4 questions, and each one, it is just 5 minutes, okay? And the total interview will be 25 minutes, okay? Then I will go to the content. The question one.
Sarah, can you just name the stations, and then you can put the links for them to see?
Yes. I forget about the question about suitability and commitment to the specialty. Then you any professionalism on governance, they will ask you about this, okay? And they will ask you like clinical scenarios, okay? And they mainly in the clinical scenario that they have to about the steps and about the treatment and the communication. Okay, sorry, I am sorry for this. Just a minute, few minutes. So just here the link. There is the links, okay, for additional information, okay, and you can go through them and can give you more details about this, show more about your about hematology as a specialty, and you can help you to fill your application in the proper way, so your application will be attractive, okay, and let them to be more successful.
Thank you very much.
Okay, thank you very much. Sorry, I am sorry for this.
That's all right. That's okay. Our next presenter is Islam, and she'll be continuing in hematology specialty, telling us about what to expect as a hematology registrar. Islam, would you like to start?
Yes, I'll be starting soon. So I hope that you see my screen, right, Fatima?
Yes, it's clear.
Okay. Thank you, Sarah. And I'll be continuing for Sarah in hematology. My name is Islam, and I will just take you through a little journey to the hematology there. So hopefully you can join us, in our specialty. So before I tell you that about what is hematology, I'll be very fast actually. And you have to know that hematology is Group 2 specialty. That's mean it does not need any 3 years of IMT, or actually you don't need to do a GIM course in the beginning. You will be trained in dual training, and this is in 2 wide ranges. The first range is laboratory medicine, and the second part is clinical hematology. Everyone's when it's hematology, the Group 2 would say, okay, this is an easy specialty there, I would apply for it. But be careful, this is a really comprehensive, big specialty and intensive. And it's demanding, in fact, and this is one of the heavy part of it. And the second part that you could think about, it's really friendly. And I'll talk you through why we do that, or why we say that by hematology. And it's really, it's a holistic specialty because it has a holistic approach. You see your patients from the beginning, you examine your patient, you take some bloods for them, you take the bloods and specimens to your lab, and then you do some, study there, and then you look under the microscope, you go back to your patient, you talk them through. And this is really interesting about hematology when you think about that. If you type of personality that you want to be involved in everything, and then you have to think about it in a bit, actually. Okay, it's a 5 years training, it's not 4, and you have to know it's 5 years training. And you would be working in a district general hospitals and tertiary hospitals. I mentioned this clearly because it's not about not having an on-calls for hematology, because you would be having on-calls actually. And especially when you get to the tertiary hospitals, you would just find like you are following a big teams. I would just go firstly about mentioning the lymphoma team and the multiple myeloma team, and then you would be like very specialized when you're working in the tertiary hospitals. And then you will be working in laboratory medicine when you need to go there and you sign some competencies during your training. And don't forget, I would like to specify this because I really was surprised when I found that's like I will be like both, like a physician, and it'll be like a laboratory medicine doctor as well. And this is one of the subspecialties in the future as well. Be careful when you mention that there's no GIM on calls, because there is actually on calls, which is be like a very heavily weighted on hematology emergencies itself. So we will not be, seeing MIs or like, this kind of PEs and things like that. But you have to know that you will be like seeing your own hematology cases, which is not really very, light as we think. And it gives you like research opportunities and academic career, and even hematology sometimes gives you like 1 year time off to go for research and to find the opportunities, for example, in a post or like even in university. And if you go for the National Hematology Register there, you will find loads of patient register, and you could even think about what type of researches do you want to do, which is really interesting, to be honest. And you would be like during training, you'd be have a formal teaching every 6 weeks or so. And when I say that, because you will say, okay, this is really very heavy specialty, and then I will just be doing a lab and I will do clinical things. I just want to reassure you that you have some teaching there, and they will take with your hand through the way, to be honest. As I said, you will be still facing acute on calls for hematology emergencies, which is you have to be ready for it. And that's why they just require you to have a general medical competencies. So you have to be competent at it, because simply you will be faced by questions during the interviews that test your competencies and test your knowledge about these kind of things. And this is one of the essential parts that you have to have when you apply for hematology. And even the hematology experience itself is a desirable one, but not an essential. But you have to be very safe in acute approaches and acute cases. Okay, I'll talk about subspecialties very fast later. And you have to take some examination as an exit exam plus the MRCP UK. So you are a hematologist, actually. It's not like a back home in Sudan, like when a hematologist is just only clinical one. I'm not sure whether this information is right or wrong, but here you have to be a complete different specialized in hematological patients and in the lab side or lab point of view. And it's not about seeing every patient in GIM like what we experience back home. Okay. Is it family friendly? It is. So it's just, you have to think about, is it like during the training or after the training? Personally, from my own search, I would say that it's after the training, it's more family friendly, like during the training, because I would say you need a lot of studying for the MRCP path, and lots of studying because of the laboratory side that which haven't been exposed before. So you need lots of work. But again, when I see like you don't need to do a night on course, I would say, okay, this is family friendly for me. So you have to think about that equally. So will I be doing night shifts? The answer is it depends. Where do you work? Do you work in tertiary hospital? Sometimes do night shifts, but sometimes from accommodations or like from home as well. You don't need to be like physically attending at hospitals, because you're not seeing like many patients, just a specialized patient for your specialty. And we already have many questions like what veterinarians I have to go for. I would not say that you have to choose one, but it's just about what you're thinking about. Okay, because specialties all divided throughout the UK. So if you want to do hemoglobinopathies, or what do you want to do? So circumstances matches on your and your subspecialties and the areas that you want to live in. I would say it's one, but it's definitely what matches what you want. Okay, so you need to have MRCP UK, and you will be having FRCP Part 1 in the year ST4 to ST5 training before you're taking that. This is a heavily sent. Be having teaching for that, you will be follow up for that, and you will be heavily supported. So if you're thinking about hematology, don't let that this examination knock you back. So if this is again FRCP path, which is an exit exam, you have to do an ST6 and 7 in this area. And sometimes you might be like extra year if you want to do a pediatric hematology. And this is subspecialties that you should think about. Generally, we divide them to malignancies and non-malignancies specialties. I just would like to highlight pediatric hematology because you would be doing an extra year for that, and it's really very interesting specialty that I love it actually, and I love this kind of taste. This is a really very interesting area. Or like completely not anything. They just sit up in the labs, do some bone marrow biopsies, reporting them, and then just go back home happy and pleasant. Okay, so day-to-day activities is not really very different from other specialties. So there is
2 minutes. Can you sum up?
Okay, almost there. There is inpatients, outpatients, and you will be doing laboratory sites again, procedures, and you will be actually contacting the GP will be contacting you, asking for some results, asking for some technical difficulties there in the lab. And then this is where you be involved in the community, and you've got liaison there. This is one of the services there. I've already mentioned that bit there, but it's very interesting to know that there is obstetric hematology, that you could have a subspecialty there. Liaison a hematology between you and the community services, and you've got transplantation services, autologous systems or transplantations. So it's really very interesting area if you want to go deep and advance any kind of person that you want to be challenging everything. The useful website that already Sarah mentioned them, go there. Please go for the health careers. You'll find very useful videos about people who went through this specialty, and go to RCB London for spotlights. You'll find very nice videos there as well. If you take these messages with you, know them before you go for interview if you've been like a shortlisted, and you know that this is very kind of information like the National Hematology Register, the Clinical References Group, and the COVID outcome related to hemoglobinopathies, which has really been emerging these days. So don't go to interview before knowing that about hematology. And please go for online events, academic meetings, courses, conferences. Do that before you go for interview. This is really enhance your commitments. And lastly, please don't forget to fill the feedback forms, and stay tuned and in touch, because we're aiming for interview workshops if you've been shortlisted, and continue our mentoring program later. Okay. And thank you for your listening.
Thank you, Islam. Our next speaker should be Razaz, doing allergy medicine. Razaz, would you like to share your slides?
I'm just stopping my share.
Yeah.
Thank you. Yeah.
Hello, everyone. So I'm Razaz Idris. I work as SHO in General Medicine, Mayo University Hospital in Mayo, Dublin, in Mayo in Ireland. So I'm going to represent today about allergy and clinical immunology. Can you hear me well, everyone?
Yes, we can hear you.
All right, good. So just I want to highlight that there is an application has been made to change the name of the specialty of allergy to allergy clinical immunology. And there is another application has been made to change the name of the specialty of immunology to allergy clinical and laboratory immunology. So they are two different specialties. They might seem the same, but there is a bit of difference, okay? So I'm going to present about allergy, clinical immunology, and later on my colleagues will present about allergy, clinical, and laboratory immunology. All right. Okay, so the topics that I will try to cover today is what is clinical allergy and why should you become clinical allergist, and insight into the career itself, the application, and one scenario for the allergy interview. I think the time is not going to be enough to cover the scenario, so the scenario you'll find it in the presentation. For those who are interested, they can see it later on, okay? Now, so this is specialty that deals with allergic disease. Allergic diseases has been in increasing lately. So it covers severe asthma, hay fever, life-threatening allergies like food, drugs, anaphylaxis, spontaneous angioedema, and so on. And the allergist focus on identifying the allergen, which is the cause of the allergy itself, and the treatment. So most importantly, the allergist improves the patient's quality of life from simple things like hay fever to dealing with most life-threatening conditions like anaphylaxis. So they provide patients with confidence and with improvement in their lives in general. So if we ask ourselves, why should we take clinical allergy as a career? There are good few things, like for example, if you wish to continue academic and clinical work both together, you can go to allergy. And if you are interested also in research and lab work, if you like to work in a multidisciplinary team, and if you love the challenge of tricky and unusual diagnosis, and if you want a healthy work-life balance. So most of the clinical care in allergy is outpatient based. Okay, so it's going to be within office hour from 9 to 5. That's the healthy life balance. And the allergist shares patients with many specialties like respiratory physicians, dermatologists, ENT surgeons, gastroenterologists, occupational health physicians, and pediatricians. Okay, and also they work closely with nurses, dietitians, and as I said, it's a multidisciplinary approach. Now, I'm going to highlight a few things about pediatric allergy and clinical immunology. So this specialty is recent, started in 2001. It deals with multi-organ systems, like covering most of the systems in the body. So they are going to have shared clinics or joint clinics with allergy and gastroenterology clinics, allergy and respiratory clinics, dermatology clinics, and share clinics with ENT. Right. So let's see an insight into a pediatric allergist day. This is a true example for a consultant who works in Guy's and St. Thomas NHS Trust, and also in King's College in London University. So the clinical working hours is from 9 to 5, as I said previously. If you are a trainee, you will have to cover the pediatric on-calls, but when you become a consultant, so it's up to you, you can choose to cover or not. Then the outpatient clinics start from 9 to 1. Usually the consultant sees from less than 10 patients. Then you examine, take history, order investigations, interpret them, prescribing medications, answer the patient's queries, and most importantly, you recruit patients to your research projects. Then after that, the time is all yours. So sometimes there might be meetings, presentations, sometimes there might be lectures, attending courses, and also research work and lab work. Okay. Now, let's come to the training in allergy and clinical immunology. So the duration of training is only 4 years training, right? And the training is usually based at a single center. So in the UK, there are 7 training centers, but usually it's going to be in a single center. However, sometimes they might ask you to go from a center to another one. By the end of ST5, you are going to have an examination called Allergy and Clinical Immunology Certificate Exam, or FRC Pass Part 1. But the good thing is if you fail that exam, that won't stop you from progression to the final year. However, you have to pass the exam prior to get the certificate of completion of the specialty. Now let's come to the entry criteria. So the qualification, the applicant must have the MBBS and have full membership of either MRCP or MRCPCH of the UK. They can also apply through MRCPI, which is Irish one, either in pediatric or medicine, but applicants should complete the basic specialty training in Ireland to be eligible for application. Now, the applicants, obviously must have GMC registration or be eligible for that, and must have evidence of UK Foundation program or equivalent program, and must be eligible to work in the UK. Now, there are physician applicants and there are pediatric applicants for the specialty. So they should provide evidence for achievement of core medical capabilities. We know either through successful completion, or you are currently employed in a program and will complete by the advertised post date of one of the following routes, either the internal medical training or acute care common STEM, or for internal medicine or for acute medicine, also through the broad-based training, and or through GRCP-TB International Level 3 training program. I've put a link that for the hospitals in the world that are agreed by them, or an easier way through evidence of achievement of alternative certificate. I also put a link for that at the end of the presentation. Now, the pediatric applicants can...
That's 2 minutes.
All right. Okay, so pediatric applicants through successful completion, or they are currently employed in level 1 pediatric competencies. And for career progression, the applicant must provide a full complete details of their employment, either physicians or pediatricians, both of them. And if they are in another training program, they should tell the training program directory about that they are moving. They are things that they must not be, okay? Now, from the desirable criteria, the higher degrees, and for person specification, they look at the clinical skills and knowledge, the researches, the teaching skills, personal skills, and the commitment to the specialty itself. All right, so we can find more information about everyone here. Okay, personal skills, which includes communication, values, organization, and planning, coping with pressure, and the commitment to the specialty. They look more into that. All right, so this is the interview scenario. I think who are interested in allergies, they can go through it. So it's one of the most common interview scenarios that you can have in the interview by itself, okay? So
Azaz, I can give you 1 minute for the scenario because it would be important. Can you go through it in a minute?
Okay, I will go through the most important things. So
Okay.
We have a 40 years old Mr. John. He was working in his garden when he felt a swab bite, and immediately within minutes, he got shortness of breath, and his face and lips and tongue have swollen up. He developed a generalized giant articulated rash all over his body. He presented to the A&E. So in examination, we find the ECG is sinus rhythm with pulse of 98. So his tachycardic oxygen saturation is 87. And his blood pressure is 82/44, respiratory rate of 30. So they can ask you, what is your suspected diagnosis? So this is anaphylaxis, most likely due to the insect bite. So what's your immediate plan of action? You start with high flow oxygen, and you might go for intubation of the patient if there is a respiratory obstruction. If you are suspecting respiratory obstruction, you go with adrenaline, intramuscular injection, 0.5 mils, and the dose can be repeated according to the vitals of the patient. You go with IV infusions, colloids or crystalloids. Usually we use normal saline, 500 ml over 15 minutes, and it can be up to 2 liters. You go with antihistamines, IV, and hydrocortisone. However, for both the antihistamine and hydrocortisone Cochrane reviews, they show that the evidence is lacking for both, but they are recommended to continue as custom and as in the clinical practice. So we will go with that, okay? Then they might ask you if your patient is still wheezing, what's next? So you are going to treat as asthma. Sometimes your patient might need a ventilatory support. Then they might ask you, after all of your initial management, your patient blood pressure is still low, it's 90/50 now. Here you are going to go directly to the ICU admission. Here I want to highlight that clinical allergists, they work in the emergency department and they work in the ICUs. They see patients there also. Then they tell you that your patient is stable now. What's next? You're still going to admit the patient to the ward for at least 8 hours. Make sure that everything is fine. With ECG, monitor antihistamine, oral QDS, and most importantly, before discharging your patient, to teach him about the EpiPen if it's the first time. Then
we need to sum up here.
All right. Okay. So let me say the most important things regarding the allergies, and I'll ask you, what is anaphylaxis? You need to know that it's type 1 IgE-mediated hypersensitivity reaction and the reason why it happens. So that's all, I think. Okay, thank you so much.
Okay, thank you, Razaz.
Thank you.
Our next speakers will be Reem and Amira, and they'll be speaking about clinical immunology. Are you ready, Reem and Amira?
Yes, I am.
Lovely.
Right. Can everyone see and listen?
Yes, we can see your slide and we can hear you.
Right. So my name is Reem. I'm gonna present on behalf of Amira as well today because she's not able to present. So I'm going to talk about clinical immunology. And as my colleague Reza said, it's a different specialty than allergy. So the objective is, what is immunology? How is a career in immunology look like? And why to choose immunology, the application and interview. This is the objectives of the first part of the presentation. So the immunology, is as the name implies, is a study of the immune system. And the immune system contributes to almost every part of our body. For example, in the cardiovascular system, we have the autoimmune pericarditis, diseases, complication of the connective tissue diseases like endocarditis. And the renal system, we have also the vasculitis disorders and the renal transplantation, which is requires immunosuppression. GIT disorders like inflammatory bowel diseases and celiac disease. Respiratory, we have asthma and extrinsic allergical alveolitis and other autoimmune diseases. And it also involves cancer immunotherapy. I will add to this also the primary immunodeficiencies and the opportunistic infections is also part of the immunologic diseases. And the role of the immunology specialist in these diseases is to either give drugs that suppress the immune system, for example, in autoimmune diseases and transplantation, or to supplement autoantibodies in patients who have deficiency in some antibodies, and also to give immunomodulatory drugs, like for example, rheumatoid arthritis and multiple sclerosis.
Reem, I think your slides are not moving. We're still in the specialty slide.
Yeah, I'm just talking from outside the slides.
Oh, okay, fair.
All right, so another thing is monoclonal antibodies, which are used for different kinds of diseases. So how is a career in immunology? The clinical immunologists in the UK usually undertake two parts of work, which is clinical and laboratory. The clinical part is usually outpatient based. They are involved in clinics for patients with immunodeficiency, including joint pediatric clinics for children with primary immunodeficiencies. Also, they have allergy clinics and joint clinic with other specialties involving autoimmune disorders, like, for example, rheumatoid arthritis in rheumatology clinics, type 1 diabetes in endocrine clinics, vasculitis in renal clinics. And they also will add to that is the immunoglobulin infusion clinics for patients with antibody deficiency. And the laboratory part is involved liaising with other specialties in the diagnosis and management of immunologic diseases, like, for example, HIV, multiple sclerosis, tuberculosis, and all other kinds of autoimmune diseases. So you'll be involved in the interpretation and validation of the results of all these autoimmune diseases and tests. And also you'll be having a technical part ensuring the quality of the test and the assay development by measuring the biochemical or immunologic activity of a sample. And some part of the immunologists will be specialized in transplant, organ transplantation, lab tests. So we will be providing this advice and support for all these tests and diseases. Also, the immunologists can subspecialize in rheumatology, HIV, or transplantation according to their interests. So why immunology? Immunology is, as I said, is a very varied specialty, having different parts of clinical life and laboratory. You will have excellent work-life balance. There is no on-calls. You not have a night on-call or weekend on-calls. If you are also interested in academic research, there's a lot of opportunities in immunology. So that's why you would choose it. The application, as I'm not going to go through this again, is the same as every ST3 application with the same requirement. The interview is usually 30 minutes with three stations, which also are the same apart from the clinical scenario, which will be allergy immunology related. So I think that's the same that's been said before. So the suitability in the application, there is a part is a commitment and suitability. So in the interview, they will just go through what you have written in the application and will ask you to explore more about whatever you've written. So be prepared to speak more about what you've written. And to be appointable for or shortlisted or to be appointable for offer after interview, you need to have at least a 24 score in interview. And appointable mean that you are eligible to have a training in or offer, but that's not mean that you have an offer. After that interview, they will combine your interview and application score and give you a rank, and then the highest rank will get the first offers. And I think that's the end of the first part, Amira's presentation. I will go now to my presentation, the second part. So the objectives of the second presentation is new names. I think Razaz already talked about that, but I will just talk about it briefly. I'll talk about the post distribution and fill rates for 2021 last year. I'll talk about the interview dates and posts, competition ratios, training pathway, curriculum and ARCB decision aids, and the type of procedures that you'll be expected to be competent at. So yeah, this is the same what Razaz said. There is two specialties, allergy and immunology, and they now gonna change the names to allergy clinical immunology and allergy clinical and laboratory immunology. Those two specialties will be having the same interview. So if you're applying to two of them, you will gonna be interviewed once. So it's not two interviews. The competition ratios for, I'll talk about immunology. So the competition ratios for 2022 where there was 22 application and 12 posts. So the ratio was 1.67. In 2021, there was 33 application and only 6 posts. So the ratio was 5.5. So the competition is really varied and it's becoming more competitive year by year. The fill rates for 2021 round 2, there were a total of 13 posts. There's a total of 13 posts and 12 of them were filled. The timeline for the application and the interview, the application closing date is the 9th of December. And then you will be uploading the evidence between 10th and 24th of December. The interview date is 3rd of February 2022. It's only one day as by the website. The expected post for the for 2022 is going to be 0 to 8 posts, and the expected regions that will be distributed are London, South West, West Midlands, Thames Valley, Yorkshire and Humber, and Scotland. There's some regions that are not going to contribute to this year of training. Recruitment. The training pathway for immunology is the same as allergy, which you need to have core medical competencies or core pediatric competencies, and either MRCP UK diploma or MRCP CH. And then you will enter the training as ST3, and it will be 5 years training, during which you will be having to sit for FRCP path part 1, FRC path part 1 immunology, and part 2 by the end of the training. I will just give you a quick overview about what you'll be expected to be doing during your training and the ARCB decision aids. So the curriculum of immunology consists of generic capabilities in practice and specialty specific capabilities in practice. You can find them in the website and the curriculum. This will be assessed by word-based assessments like multi-consultant reports, of which you need to do 2 per year. Multi-source feedbacks, you need to do 1 per year. Case-based discussions and mini clinical examination, you need to do 7 per year. And then you need to do patient surveys, which are like feedbacks from patients that will be collected by your educational supervisor. You need to do 1 in ST3 and 1 in ST5. And you need to do critical care case presentations, which are like interesting cases that you've been involved at. and you need to do 2 per year from ST4 to ST7. And as I said, you need to pass the part 1 FRC path by ST5 and part 2 by ST7. You need to do certain procedures, which I'll talk to you about in the next slides. And you need to deliver some teaching and have feedback, one in ST4 and one in ST7. And you need to do 2 PUI projects, one in ST4 and one in ST6. And you need to have a valid ALS throughout your training. So this is a specialty specific tips. I will not go through them in details, but there are 8 of them, and you are expected to build competency and become independent in performing all of these tips by the end of your training. So the procedures, there is a varied range of procedures. Some of them you need to be competent at doing them unsupervised from the first year, and some of them you'll be competent in doing them unsupervised throughout the years, which are the skin prick testing, intradermal testing, drug provocation testing, food provocation testing, drug desensitization, aeroallergen immunotherapy, venom immunotherapy, perioperative anaphylaxis assessment, spirometry, fractional exhaled nitric oxide, and anterior rhinoscopy. So as you can see, the very varied range of procedures according to the diseases that you're going to deal with. And by the end of your training, you need to be able to do all these procedures or tests unsupervised. That's the end of my presentation. So in summary, immunology involves management of allergic, autoimmune, and immunodeficiency disorders. It has a similar range of our scope of practice as allergy, but with more focus on autoimmune immunodeficiency disorders. And it's a 5-year training, in contrast to the allergy with this 4-year training. The working life includes clinics and laboratory work. It has an excellent work-life balance with no on-call commitment. It's a very competitive specialty, and it's becoming more competitive year by year. You will have teaching and research opportunities, and you will have all of the opportunity to work in the clinics and the labs. I think that's it. For any questions, please put them on the chat and I'll answer in the end of the day. Thank you.
Thank you very much. Shall we move on to our next speaker? Samar, are you ready to present?
أيوة السلام عليكم.
Walaikum assalam.
Okay,
You want to
just
share your...
trying to
Yeah.
yes. Can you see it?
Yes, we can. Samar will be presenting chemical pathology. Yes, we can see that.
Yes, thank you, Fatma. Assalamu alaikum, everyone. My name is Samar Abbas. I'm one of the internal medicine trainees in Colchester Hospital. Today, I will take you through one of the very interesting medical specialties, which might be new for most of us. And although it's not really new, like in the medical practice, it have been there since 2005, surprisingly, but most of us just recently or never heard about it. So I will take you through chemical pathology as a specialty and some of the interesting sides of it. And then my colleague Reem gonna also speak about some of the other relevant parts. Okay. So starting by giving a simple definition for chemical pathology. First, we need to know that it used to be called clinical biochemistry and medical biochemistry. So maybe you will not be familiar with chemical pathology as a name. Even in your hospital, if you ask about the chemical pathologist consultant, they will tell you, we have never heard about such a person. But if you ask about a clinical biochemistry or medical biochemistry consultant, you will definitely find someone of them. So it's a specialty that uses chemical tests to diagnose diseases and monitor treatment. And these investigations have become essential in providing safe and effective patient care on a daily basis in every medical practice. So it's basically you are a physician, but working hand to hand with the laboratory people, not essentially doing the laboratory test yourself, but you will be very much involved with the analysis of the results and like making decisions out of them. Okay, so chemical pathologists offer clinical and scientific leadership to a laboratory service, as we said, providing these investigations as well as clinical advice for the daily management of patients. In addition, chemical pathology consultants provide specialized direct clinical care and secondary care for patients with a variety of common and rare metabolic disorders. Okay, well, you gonna be in the training. So training in the chemical pathology can also, the trainees can also gain a subspecialty accreditation in metabolic medicine. So now it's a bit confusing whether they are like separate or no, they are the same. I think they are going to be just like the same specialty. They used to be called like separately as two separate entities, and you have like metabolic medicine as a subspecialty of the chemical pathology, but they have been kind of gathered into one specialty. So you will be involved predominantly in the outpatient clinics. So your work basically will be like divided between clinical kind of work, laboratory work, and again, research and other kind of things. So the outpatient clinics, there will be mainly like the bone clinics, the diabetes clinics, lipid clinics, and some other more clinics. And as we said, you will be also clinically involved, like in a day care of your patient, like the short stay 24-hour care, like only for patient who comes for rapid infusions, for example, patients with Baggett's disease who can come only for bisphosphonate infusions and go in less than 24 hours. So, and then and the laboratory work will be one of the cornerstones of your work, as during your training, you will be involved so much in the lab work. So you will get in touch with the laboratory people. You will learn how to do some of the basic laboratory investigations. But that doesn't mean when you are a consultant, you will have to do them. No, you will know them in your training and you will know how they are done. But when you are a consultant, you will only be asked to just do the assessment and the analysis of the results and such things. So the duration of the training, so we can say generally like it's a 5 years and it can be extended into 5.5 years. That was like the last year when they said that metabolic medicine will be done in the last 6 months. So we can say in general it is 5.5 years. So you will have a great opportunity to take a research or out of program training during your time. And usually the training will be in tertiary hospitals. We will come now to the exciting part. So it is only Monday to Friday. That will be your working hours from 9 to 5 p.m. And during these working hours, you will have your own admin time as well. So you will have the time to do your studies, to read, and to complete your portfolio, to do your letters for your patients, to do whatever you like, basically. And you will be even very much supported during that. And so you will not have any weekends and no on-calls, definitely. So we can say basically it is very family-friendly specialty. So coming to the next part, which is the stages of the training. So we can divide them into 4 stages, A, B, C, and D. The first 2 stages are the first 2 years in your training, the A and B one, which, as we said, you will be introduced to the basic principles of chemical pathology and gain practical experience, and will need to demonstrate that you can deal with some of the day-to-day issues in a hospital chemical pathology laboratory, so much involved in the lab. You will also be gaining clinical experience of managing patients in the outpatient department. And then during the first 2 stages, you will have to complete your first exam. We will come to it in the next slide. So the stage C, the curriculum focuses more on your ability to practice chemical pathology at a consultant level. So you will be given more responsibilities, basically. You will undertake service development projects and audits, as well as building your clinical experience. By the end of the stage C, you will have completed Royal College of Pathologists exam, as we said at the first part, and be able to manage patients in the following areas like lipids, diabetes, and Reem gonna talk to us more about these. The last stage, you will be expected to work more independently. You will be given the opportunity to lead projects and to be able to provide clinical leadership for a chemical pathology laboratory. So actually, you're gonna be in that stage working as a consultant. So, and during that stage, you will be expected again to finish your last exam. So the exams that we have been mentioning are basically 2 exams. The first one, which we said you will be requested to finish it by the end of the 2nd year in your training, which is the FRCP FRC Path Part 1, Clinical Biochemistry, which is a multiple choice question. So MCQs 125 short best answer, and it will be based on your curriculum stuff. And the second part, which you are expected to clear it by the end of your training, it is divided into 3 modules, practical, clinical, and a written component. So that will take me to the end of my talk, and Reem gonna continue. If you do have any questions, please put them down in the chat box and I will be happy to answer. Thank you very much.
Thank you very much. Reem, are you ready to share your slides?
Right. Hello, everyone. I am Reem again. I'm going to talk about metabolic medicine / chemical pathology. Can everyone hear me?
Yes, we can hear. Yes, we can hear you.
Okay. So I'm just going to talk about the new changes that Summer talked about. Clinical areas, working life, recruitment process, interview dates and posts, competition ratios, ARCV decision aid, and a summary in the end. So metabolic medicine used to be a subspecialty of chemical pathology, but in 2021, it was combined with a chemical pathology to form one specialty with the name chemical pathology. So there is no more metabolic medicine specialty on its own. It's all become the same, chemical pathology, which you enter at ST3 level. Chemical pathology used to be entered at ST1 level, so it wasn't required to do core competency. But since they combined it with metabolic medicine now, you have to have a core competencies to be able to apply at ST3 level. And the requirement is the same for other ST3s. It's either core medical competencies through IMT program or ACCS program or alternative certificates, and also an MRCB diploma. So the working life of a chemical pathologist, I think Summer has spoke about part of it. So it's a combined lab and clinical specialty. In your lab, you'll be responsible for running and managing the biochemistry lab, where 100 samples are analyzed each day, which the example of these tests are electrolyte tests, liver function tests, and tumor markers. The sample analysis itself will be run by automated analyzers and will be run by biomedical scientists, but you will be responsible for managing these processes and the laboratory staff itself, and you will give guidance on the selection of appropriate tests and the significance of results, especially the ones which are unusual for the biomedical scientist. And you also do the quality assurance as part of your leadership role. And then the other part of your work will be clinical, which is based in outpatient clinics and ward rounds. And this will be involved with metabolic diseases and, for example, patients who are admitted with total parenteral nutrition. And you'll also give like advice for other specialties on whatever tests they are wanting to arrange and the best test to test for specific diseases and stuff like that. On calls, you will be having on-call biochemist duties. It's not a night on-call or a weekend on-call. It will be a day on-call. Usually, it depends on the trust or hospital. But for example, it will be like 9 to 1 o'clock, 9 to 5 o'clock. So it's not very long on-calls. This is in a trainee level, but I'm not sure about the consultant level. And then you have a teaching part of your role, teaching medical students and other trainees, and visiting GP practices to provide training and education for other GP practices on the management of metabolic diseases and to run specific chemistry tests. And also you have a part in research and development of new tests. The clinical areas or subspecialties of chemical pathology / metabolic medicine are 5 areas, which are the first one is nutrition, including advice liaison with the dietitians about total parenteral nutrition, nutrition following gastric surgeries, and obesity, and you can run weight reduction clinics. The other area is cardiovascular risk and disorder of lipid metabolism. So you usually run these clinics with cardiologists and with dietitians. The third one is diabetes mellitus, and you give advice to the endocrinologist about certain interpretation of tests, and also about dietary advice. Disorders of calcium metabolism and bone, including osteoporosis, vitamin D deficiency, and kidney stones. And the last one is inherited metabolic diseases, including inborn error of metabolism, such as phenylketonuria. You can also have pediatric clinics managing these inborn errors of metabolism. The recruitment process, it's not a national recruitment. It's a recruitment led by the East Midlands Office of Health Education England. And this office will be recruiting for posts in England, Scotland, and Wales. So in your application, you will find East Midlands Office as a recruiter office, not the physician specialty recruitment office as in other specialties. But it's also be recruiting for all England and Scotland and Wales. So the application is running now. It's open and will close on the 9th of December. The interview supposed date is the 1st of April. The difference of this application from others that there is no evidence submission deadline proposed now. Maybe it's going to be uploaded in the, or like explored in the interview. I'm not sure about the evidence. The indicative posts are 2 to 12 for this round. And the regions which are gonna recruit this year are East England, London, Wessex, North East, Northwest, Yorkshire and Humber, South West Peninsula, Scotland and Wales. And the posts are usually 1 in each region. The competition ratios. So in 2019, there were only 12 applications and 17 posts. So the posts were higher than the applications because, as Samar said, it wasn't very known for everyone. So it was really non-competitive at that time. In 2020, more people know about it. So it was 23 applications, 12 posts, and the competition ratio was 1.92. In 2021 round 2, there was 16 applications and 11 posts, and the ratio is 1.42. So it's not very popular specialty, but it's which is a good thing for whoever want to apply. But we can't tell what is going to be the competition for the next year, for this year. So the ARCP decision 8 for metabolic medicine, chemical pathology combined specialty from 2021. As we can see, it's a 5 years training program. The competencies which you will be required to be competent at, you can find them in the website. You need to do 3 CBDs, 3 mini-Kexes, and 1 MSF per year. You need to do the FRC path part 1 by ST4 and part 2 by ST6. You need to do an audit during your training. And there is the unique part about this specialty is the management. They really focus on your management skills. So in your first year, not be assessed on that. In the second year, you'll be required to have evidence of awareness of and participation in some aspects of management, like for example, organization of protests, teaching sessions, or general clubs. And the next year, you'll be required to have evidence of awareness of NHS managerial structure and function, example, attending relevant courses or participating in local meetings. The ST6, you will be required to have evidence of participation in managerial activity, like, for example, writing business case, involvement in tendering for new equipment, dealing with HR issues. And by the end of the training, you'll need to have a satisfactory portfolio of management activities. This all is because you're going to be in the future as a consultant, you'll be the lead of the clinical biochemistry lab, which is a very busy lab and require a lot of managing of the tests, equipment, staff, and stuff like that. And then you'll have also required to do a research project during your training with evidence of knowing critical thinking around clinical questions and stuff like that. Teaching, you'll also be required to have adequate teaching experience during the training. So the requirements are not very varied, but the competencies are. So there is you'll have to be required to be competent at all of the competencies, which you will be find in the website. So in summary, metabolic medicine is now called chemical pathology. You'll apply for it from ST3 level. It is a specialty with combined clinical and laboratory work. You'll have excellent work-life balance. There is 5 clinical areas, which I talked about, and the recruitment is through East Midlands office. I've talked about the interview dates and competition ratios, and the training is 5 years, including FRC path exams. I think that's it. I think that's the end of the day as well. Thank you, everyone.
Thank you very much, Reem. We finished earlier than anticipated. So time for questions. If anyone has any question, please ask out loud or in the chat and I can read it out.
I've got questions to Reem. Reem, you just mentioned that, sorry guys, that's not you, just calm down. I've got questions about the research. Do you mean that someone's need to do a thesis? Like a thesis for chemical pathology and metabolic medicine before the exam?
Yeah, that's what's written in the curriculum, but I've talked to someone who is doing the training now. He said that it might be scrapped from the curriculum, so they are not required to do that during the training because of the COVID now. So we're not sure if that's going to be the case for the next years or not. But that's what is written in the curriculum.
Okay, thank you. Yeah, I've got another question about the allergy clinic that you mentioned. And then you said that I'm not sure whether it is the same for the clinic immunology allergy clinics, or it's different from the allergy medicine clinics. Are they the same or?
Yeah, they're the same allergy clinics. I think that the immunology and allergy trainees work together. The curriculum is very similar. It's just the difference is the duration of training for clinical immunology and scope of practice. allergy mainly focus on allergy clinics and allergy diseases, but the immunology they will have other autoimmune and immunodeficiency and antibodies, stuff like that. So it's just an added part, but the same allergy clinics.
Okay, thank you.
Any other questions? I can't see any further questions in the chat. If I've missed anything, Islam, let me know.
Not as far as I think you covered anything there.
Okay. Does
Yeah.
anyone want to say anything else if there's no further questions?
So I think I might be saying that I know these people here are most of the presenters, but if you know anyone who attended this previously, and then please share with them the feedback, because it's very important to have this one in case of our evidences. And thank you very much. And thank you, Fatima, for running this day.
Thank you
I think
very much.
someone asked about the feedback in the chat.
Let's see.
So Yusra, this is feedback for all of us, for all events. So it's not individual one, otherwise we'd be doing like 15 feedbacks. And it's only one for all the events, and it will cover everything. So you don't need to do one at your own.
Okay. Anyone else from the presenters want to say anything? We still have some time.
I have a question about the oral applications.
Mm-hmm. Yes, go ahead.
Yeah, I think Islam mentioned that before, and I talked to Samar about it, about the application that autofill bars. So if you're doing more than one application, do you need to enter everything every time? Does anyone figure the way to not do that?
I have actually. They have to give me a prize for that.
Amazing.
Well, it was a little bit hectic, isn't it? So you have to submit one first. So if you submit one of your applications, and then you might be able to copy it for the next one.
Is this guaranteed?
Yes, it is actually, because I've done it myself.
Okay.
Yes, Islam
Yes.
is right. So when you finish one of your applications and you complete it totally, you press the submit button, and then when you start the new one, you will a small message will appear in the center of your screen and tell you if you want to copy the information from the first or from whichever. If you have done multiple one, it will give you the list of the applications that you have submitted, and you will kind of be able to choose one of them, and if they are just the same, you can pick anyone.
All right, thank you guys.
I'll just give like a small advice there. So when you do that, make sure that you read the application again, because they're not all the same as we mentioned. There is some small differences in applications when you open them, especially for group 2. If you're doing for group 2 and group 1, make sure that you revise it, because sometimes they generate not really the exact information that you put in. So revise it before you submit it. Okay.
All right, thank you, Islam.
Okay. Any further questions or any comments, even if from our audience?
Thanks for all presenters. That was very, very informative. Thanks.
I would like
Thank you,
also
everyone.
to thank you all and thank the admins particularly for giving us this opportunity to do the presentations in this very important time of our applications. So I wish you all the best. Thank you.
Lovely. I think we've come to the end of the Taster Days. I hope it was helpful for everyone. And thank you very much for all the presenters. It was very great, impressive presentations. And thank you for all the participants and everyone who joined in and listened. Please don't forget to fill up the feedback form. The link has been sent a couple of times in the chat. And the presenters have sent their emails. And even if you didn't get a chance right away, we'll also send them in the Sajda group. So please try to do that and help them out with the feedback. Thank you very much. Does anyone want to add anything else?
Yeah, hi. I just want to thank everyone here, but is from all the group is our special thanks to Islam. Really, very thankful Islam because you make these days very nice and you spend a lot of time arranging for these days. We really appreciate your help. So thanks very much and I hope for you whatever you want. Thank you very much.
Thank you. That's really lovely to hear from you. Thank you.
Thank you. Islam has worked very hard coordinating all this. So thanks to her and thanks to everyone. You worked, I mean, in a very short time and it was very impressive, all the presentations and the information. I hope everyone benefited from this. Okay.
Thank you, everyone.
Thank you. Have a
Thank
nice
you. I think we'll end the
Thank you.
meeting.
Best wishes for all of you.
Thank you. Thank you.
Good
Also,
night.
anything else?
Thank you. Thank you.
Not you. You can still awake. Give mommy a kiss. Goodbye.